Hello, everyone. Welcome back. Today is the third lecture of microbiology, and we will continue. Last time in the first lecture, we have already discussed exotoxins, endotoxins, their comparison, and we have talked about the bacteria with the exotoxins. Um, we have talked about hemolytic uremic syndrome already. We have talked about the type of E. coli, different types of E. coli, the toxins they produce, the diseases they cause. We have talked about pertussis. We have talked about tetanus already. Today we'll continue from Clostridium and Clostridium botulinum. So in the last lecture, we have talked about Clostridium tetani, the tetanus plasmin they produce, the tetanus they cause, the prevention, treatment, all about that. Very high yield topic for step 1 and step 2 preparation. But before that, before we jump into Clostridium botulinum, first I want to discuss anthrax because we have already talked about Bacillus anthracis, but we did not talk about the disease anthrax, which is caused by Bacillus anthracis. So, what is anthrax? So, anthrax is caused by Bacillus anthracis, and Bacillus anthracis is a gram positive, is a spore forming gram positive rod. So it produces spores. The toxin it produces is anthrax toxin. There are two toxins, two virulence factors you should remember for anthrax, for Bacillus anthracis. The first is trimeric exotoxin, which is also known as anthrax toxin. And anthrax toxin has uh, let me go there to show you guys. Well, oh yeah, here. So we will talk about anthrax today in detail. So Bacillus and anthrax is caused by Bacillus anthracis, and Bacillus anthracis is a gram-positive spore-forming rod that produces anthrax toxin. Anthrax toxin is also known as trimeric exotoxin, and it has three parts. This exotoxin has three components. The first is protective antigen, lethal factor, and edema factor. Always remember their name, very high yield. Then another virulence factor is polypeptide capsule, which is made up of polydeglutamate. Usually the composition of capsule is, I think, polysaccharide, but it is made up of polypeptide polydeglutamate. Very high yield point for step 1. And so yeah, these two virulence factors you should remember. And then anthrax, all there are two types of anthrax: cutaneous anthrax and pulmonary anthrax. First we will cover cutaneous anthrax. Remember, cutaneous anthrax, always remember the word, always remember black painless lesion. If you will remember this, you will remember everything about cutaneous anthrax. Black painless lesion. So there are three steps of progression of cutaneous anthrax. First is there is a painless papule. This image is very important. First step is a formation of painless papule. Second step is that painless papule is surrounded by vesicles. So you can see here these vesicles. Okay, so first is the painless papule, then painless papule is surrounded by vesicles, and then there is a formation of ulcer with black eschar. Okay, so painless black painless lesion. The first is painless papule, then vesicles, and then ulcer with black scar. It is a local infection and it rarely causes bacteremia. Then it can cause death, but it's very uncommon finding. It is usually, mostly it is a local infection, but it can uncommonly, but it can progress to bacteremia and eventually death. This is very important image. You should remember their toxins. Remember, it's painless lesion. Now let's talk about pulmonary anthrax, and pulmonary anthrax is also called Wilson's disease. Again, high yield point. How it happens, how pulmonary anthrax happens. Easy peasy, inhalation of spores, most commonly from contaminated animals or animal products, and although also a potential bioweapon. So pulmonary anthrax, also called Wilson's disease, it happens through inhalation of spores. First it looks like an upper respiratory infection, like flu-like symptoms. First you will experience, the patient will experience flu-like symptoms, and then it progresses rapidly. So the initial step is flu-like symptoms in pulmonary anthrax. Then there is a rapid progression that leads to high-grade fever, respiratory distress, and then there are severe complications that includes pulmonary hemorrhage, mediastinitis, and shock. Okay, so always remember in steps: flu-like symptoms, then high fever, respiratory distress, and then complications that include pulmonary hemorrhage, mediastinitis, and shock. Chest X-ray is high yield, is very high yield. Chest X-ray finding is widened mediastinum. Okay, widened mediastinum wide due to hemorrhagic mediastinitis. How, if you see in the exam, in the board question, if you see patient has flu-like symptoms plus widened mediastinum, think about pulmonary anthrax until proven otherwise. Okay, how we treat patient post exposure prophylaxis is with ciprofloxacin, which is fluoroquinolones, or doxycycline. Okay, now we will talk about, um, last time we have talked about Clostridium tetanus. Now we will talk about botulinum. Okay, okay. Clostridium botulinum. I will also compare Clostridium botulinum from Clostridium tetani, so you can memorize easily for exam, from for exam point of view. First is Clostridium botulinum. It produces a toxin called botulinum toxin. What is the mechanism of action of that botulinum toxin? It works similar to tetanospasmin, a toxin produced by Clostridium tetani. How it works similar? Both Clostridium botulinum toxin and tetanospasmin, they both are proteases. That means they break down protein. So what they do is they both are proteases that cleave snare protein, and that protein is required for neurotransmitter to get released from the vesicle. Okay, when this when what happens in botulinum, what happens is Clostridium botulinum produces botulinum toxin, and that toxin inhibits, it cleaves the snare protein, so neurotransmitter cannot get released into the synaptic cleft. Okay, um, what neurotransmitter? It blocks, Clostridium botulinum blocks the release of acetylcholine neurotransmitter at the neuromuscular junction. In Clostridium tetani, tetanospasmin prevents the release of GABA and glycine neurotransmitter, inhibitory neurotransmitters. Okay, so in botulinum, always remember word floppy with botulinum, and with tetanus, always remember tight. We have talked about that in tetanus there is a spastic paralysis because of decreased release of glycine and GABA neurotransmitters, inhibitory neurotransmitters. In botulinum, there are there is a flaccid paralysis, and the baby is floppy baby. Okay, while in tetanus there is a spastic paralysis. Okay, um, in Clostridium botulinum, we will see there is a descending paralysis. Okay, in tetanus there was ascending paralysis with locked jaw, rhizus sardonicus, opisthotonus. We have talked about that in detail yesterday. In Clostridium botulinum, there is a descending paralysis. The paralysis goes down from cranium, it goes down. Okay, um, how key buzzwords you should remember for Clostridium botulinum is like let's first talk about this. There are two types of botulinum: infant botulism and the foodborne botulism. So infant botulism, usually seen in infant under the age of 1 year. I mean, it is caused by ingestion of spores from soil or raw honey, and toxin is produced in vivo. Very important point. Infant botulism, remember, infants eat spores. They are eating spores and not toxin. So infants eat spore, and toxin is made inside the body. Toxin is produced in vivo. Okay, so infants eat spores, and then toxin is produced inside the body. Why? Uh, Adult botulism or foodborne botulism, which is seen in adults, is caused by ingestion of preformed toxins. Adults are eating toxins, not spores, okay, from canned foods. So in adults eat toxin. Infants eat spores, and then toxin is made inside the body. Adults eat toxin. Toxin is already made outside. Okay, very high yield differentiating point. So the buzzwords you should remember for botulism is honey for infant botulism, or remember cane food for adult botulism, and then floppy baby, the blood vision, because there is a descending paralysis. Okay, um, for tetanus we have immunity, we have vaccine, toxoid vaccine, and tetanus toxoid vaccine. But for botulism we don't have any vaccine. Okay, and the buzzwords for tetanus you should remember is spores in wound, tetanus spasmin toxin, remember lockjaw, and there is immunity for tetanus and not for botulism. This image is very high. Let me show if I can zoom in. I hope it's clear. So look, this is left side is the normal. We have synaptic vesicle that contains acetylcholine neurotransmitter, and what happens is this synaptic vesicle needs snare protein, and the snare protein helps the binding of vesicle to the synaptic membrane, and then this acetylcholine gets released into the synaptic cleft, and then it binds to the receptors on the muscle cell neuromuscular junction. What happens in botulism, there that botulinum toxin cleaved, look, it breaks down snare protein. So snare protein is not present to bind that vesicle to the synaptic membrane, and hence no acetylcholine get released into the synaptic cleft and cannot bind into them at the neuromuscular junction, and no nerve impulse, and it leads to flaccid paralysis, descending flaccid paralysis. Very high yield image. Okay, now let's talk about um, what are the cases you can get in the exam. So you should remember those buzzwords. If there is a case that shows this, that says the 7-month-old baby or 6-month-old baby with constipation and poor suck and floppy, baby's floppy, and there is a history of honey, raw honey exposure, think about botulism. Okay, or if there is a case of adult and um, after eating canned food and there is diplopia, dysphagia, and descending paralysis, think about foodborne botulism or adult botulism. If there is a case of after dirty wound, there is a lockjaw, or there's a spastic paralysis, there's a spasm of the back muscles, rhizus sardonicus, think about tetanus. Okay, now the last topic is Clostridium perfringens. We have four types of spore producing bacteria. We will repeat this again. So we have talked about Clostridium tetanus, we have talked about Clostridium botulinum. Now we are talking about Clostridium perfringens, and then we will talk about Clostridium difficile, again very important bacteria, spore producing bacteria you should know, but we'll talk about that in the next lecture. So this is Clostridium perfringens, and for Clostridium perfringens, remember that they produce a toxin called alpha toxin. Think Clostridium perfringens as a gas producing bacteria, and they cause muscle eating, gas producing muscle eating bacteria. Okay, what is the virulence factor for Clostridium perfringens is alpha toxin. Okay, and what is alpha toxin? Alpha toxin is a lecithinase, is a phospholipase. And from the name, it is very clear. Phospholipase. Lipase means it's going to break down the phospholipid membrane. So it breaks down the phospholipids in the cell membrane, and then it causes cell destruction and tissue necrosis, and hence hemolysis. Okay, So it produces alpha toxin is a phospholipase. Lecithinase breaks down phospholipids. There is a degradation of phospholipids that leads to myonecrosis. Myonecrosis is a muscle death, and then when there is a muscle death, produces it causes gas gangrene and hemolysis. And what type of hemolysis will be there? When you see on the blood agar, there is a double zone of hemolysis. Double zone means like two rings around the colony. Okay, complete hemolysis and incomplete hemolysis, you'll see two rings on the blood agar. Okay, um, usually it causes gas gangrene. Always remember myonecrosis and gas gangrene, and usually it happens after trauma, or war injuries or surgeries. um, there is how is the usually the presentation is like, after trauma or after surgery, there is severe pain in the muscle death, and the bacteria Clostridium perfringens produces bacteria due to fermentation, and there would be crepitus under the skin, air under the skin. There will be foul smelling discharge. To think about this, these are very high yield point, like muscle death, myonecrosis, gas production or crepitus under the skin, and then foul smelling discharge. So these are the buzzwords for Clostridium perfringens you should remember. Um, I think this is all for today's lecture. If you guys have any questions, you can ask me in the comment section. Let me know if you want me to teach anything specific. Thank you.